I'm a PT and I'm wondering what my role is with concussion. This is perfect. I feel that it's mainly for vestibular issues, but you often talk about more stuff. Okay, so this is like exactly what I've been talking about. This particular area, the whole field of concussion essentially is rehab. A lot of the research that's coming out in this space right now is showing that the best treatments for concussion are things like exercise therapy, right? Doing sub-symptom threshold exercise, using treadmill testing and things like that. Dietary interventions. I know some PTs can do that, some can't. It depends on your jurisdiction and area. It's a lot for chiros. So I'm going to lump chiros into this field as well, PTDC, so rehabilitation professionals. There's dietary interventions that can help with lowering inflammation. There's visual and vestibular issues. So you touched on vestibular, that's a huge component, but also the visual system and just ocular motor. And oftentimes that just requires proper assessment, some basic rehab that might go into it. Oftentimes you may need to refer that person to some more advanced vision rehab, but probably about 85% of cases you might be able to get them better just with doing some basic visual ocular motor stuff. And oftentimes the ocular motor stuff and the vestibular side of things is tied in intricately with the neck. And so when you get a concussion, there's also whiplash injuries that happen at the same time, and the symptoms of whiplash and concussion are literally identical. So then it's going, okay, how do I separate whether or not this is ocular motor, visual, vestibular, or neck related, right? So basically, treatment for concussion is rehabilitation. And so the people that are going to be doing this type of rehabilitation are very heavy on the PT, chiro, AT front, right? We often think concussion, we think, MD neurologist, but really in reality, prescription medication doesn't work for concussion patients. Imaging like MRIs and things like that a physician may order are often normal and negative, so it doesn't really show you or tell you anything. But really what you need somebody to figure out what's causing the symptoms and then be able to provide the appropriate rehab and treatment for those symptoms. And oftentimes it's PT, it's chiro, it's AT, it's OT, it's people that do rehabilitation. And I think that's something we have to wrap our heads around as concussion clinicians and as rehab professionals, is that this is our space, right? So you need to familiarize yourself with this and get the tools and training and knowledge so that you can help more people. Concussion is more than vestibular. It is. There was a study that just came out, and in it said that even patients with dizziness, with concussion-related dizziness, and they're going through vestibular therapy, you would have to treat between 2 and 4 patients to have positive outcomes in one patient. That means that vestibular therapy for patients with dizziness, right, which is what vestibular is for, right? You have dizziness, people assume vestibular. You would have to treat 2 to 4 patients to get a benefit in one, which essentially means that you're only getting 25% to 50% of patients better if you're just doing vestibular. So there's a whole other world out there for us PT, DC, AT, OTs that is not even really being looked at because we're sitting here thinking vestibular. And all our patients are not getting the appropriate care because they're going through vestibular rehab, but guess what? It's not working, right? And the reason is because we're hammering vestibular thinking it's a vestibular problem when it's not, right? And you need the tools to be able to figure out what it actually is. So for PTs, there's a whole world out there that you may not be aware of yet, but I think that it's coming, and I'm trying my best to try and spread that message. So thank you for your question.